Good morning, everyone, and I'm Grace, Minister for Education, Minister for Industrial Relations and Minister for Racing, and I'm very glad to deliver the COVID report this morning. And today we have a double donut day. We have 0 new cases in the community and 0 cases detected in hotel quarantine. Currently that leaves us with 26 active cases and 2,082 total cases here in Queensland. We're up to 74.1% single dose vaccination, and we're nearly at the 60% double dose, with 59.36% of the population 16 and over double vax, which is great news as we edge towards the 70% and of course the much needed 80% vaccination rates. Today is Super Saturday, and it's great to be here at Cav Road State High with local member Joe Kelly, and Joe is a registered nurse as well, and Joe has been also administering jabs, and I think he's up to over 200 already, so it's great to have member for Greenslopes Joe Kelly here with us at Cav Road. Today, of course, is, as I said, Super Saturday. We've got 116 schools open this morning. Cav Road's been open since 8 a.m. and Principal Usher tells me that we've already had well over 40 people come through and get their jab. And I met Felix, a young 12-year-old in Year 7 at Cav Road, who got his jab, and he was very proud to have done so. So can I encourage everyone, the access is in a beautiful, safe environment in our schools, and we need you to come out and get vaccinated today. Schools are open right across the state, 116 of those. We also had 4 of these schools open for 2 hours yesterday afternoon: Kelvin Grove, Cleveland, Bray Park and Aldridge, and just in that couple of hours we had 112 come through to get vaccinated. So it's wonderful to see, and I believe that we're up to about 18,660 yesterday come out to get vaccinated, and that's up over 3,000. But I can get Dr. James Smith, our Deputy Chief Health Officer, to say a few words after I've spoken. But the message is clear. Obviously, if you haven't been vaccinated, please come out and take advantage of our 116 school locations, as well, of course, as all the other vax clinics that are open for you to walk in and get the jab. In addition to that, we're making sure that we can have parents and friends and families and your mates to come in and get vaccinated, and you can walk in at any of those locations right across the state. Can I urge that don't do it for yourself? There was young Courtney, who I was with in Townsville this week, who had been double vaxxed, and she did it for her elderly grandparents and for her young siblings. And if you don't want to do it for yourself, do it for your family, do it for your elderly grandparents, your young siblings, your aunts, your uncles, whoever, but make sure that you do get vaccinated. That is our message, of course, today, very loud and clear. Queenslanders have done a great job when it comes to COVID. We've got a roadmap to open up to normality. However, that normality will protect us all if we get as many vaccinated as possible. And we've been up and down throughout the state this week, making sure that message is out. And it's great to see that well over 3,500 people, additional to the numbers we were having, came out. But we would like to see more, and I'm sure that Dr. James Smith will come through with that as well. We are the first state also to put all of our school staff and early childhood educators on Category 1B, and I'm pleased to announce today that since we did that on the 8th of August, over 70,000 have come out and been vaccinated, which is great news for Queensland and great news for our school students, who also, of course, those in high school can get vaccinated. We really need our high school students to come out and get vaccinated, but in particular young people aged around 19 to 39 to come out to get their vaccination. That is a group that is slightly down to the average, and we're urging that group in particular to come out and get vaccinated as well. We've got a great window of opportunity before we open up in accordance with the roadmap, and it'll be wonderful to see that 90% mark reached right ahead of schedule, where a lot of those restrictions will be lifted and we'll be able to really get back to normality, even though Queensland, we've had freedoms here that other states have not enjoyed, and that's because Queensland have done the right thing. But for more information, I'll hand over to Dr. James Smith, our Deputy Chief Health Officer.
Thank you very much, Minister, and good morning, everyone. So as the Minister's mentioned already, we've had 0 new cases over the last 24-hour period, which is really good news. That brings our case numbers to 2,082, with 26 active cases in the community. So that's good news, obviously, but it doesn't mean that COVID's not coming, and COVID is absolutely on its way, and that's going to be the outcome of opening the borders. While we believe opening the borders is safe, and moving through those milestones as we get through to 70, 80, then 90, COVID very much will come into the community, making vaccination critical. The reason vaccination is so critical is that we've only got 3 methods to manage coronavirus once it is in the community. So the first is contact tracing, and that's a relatively constrained capacity that we've tried to increase as much as we can, but it's fairly fixed. We then have societal restrictions, and after that we have vaccination. And that really means there's a balance between societal restrictions and vaccination. The higher the vaccination coverage, the less you need to use the societal restrictions, things like lockdowns and so on. So as we move forward, we'll be tracking very closely the vaccination coverage in areas, and as we get outbreaks in small areas, we may have to titrate, move up and dial up and down the societal restrictions that are needed to control local outbreaks according to the amount of vaccination coverage in those particular areas. So that's really a call out to people. Everyone needs to get vaccinated, particularly people in rural areas. Brisbane's not doing too badly, but in many regional and remote areas, particularly in smaller communities, I guess there's a sense of apprehension and even a sense of complacency, people feeling that perhaps COVID isn't the immediate risk that it actually is. Those people also often have more difficulty accessing health services due to the geographic location that they live in. So we really encourage people in regional Queensland to come forward today and to get vaccinated. There's plenty of opportunities available. There's lots of pop-up clinics. As the Minister's mentioned earlier, we've got 116 schools up today on this Super Saturday. So what would really encourage you to do is get on the Queensland Health website, find out where the closest schools are or the closest other opportunities, mass vaccination clinics, for example, where you can obtain a vaccine, and come forward and get vaccinated. That's our main message at the moment. Thanks very much.
Good morning. I think like every nurse and every doctor in Queensland, we want people to go and get vaccinated because we want them to be safe. If we had a vaccination for cancer or for heart disease, people would be lining up down the street to get that. The reality is we have a great vaccination, a range of them, for a very serious disease, COVID-19, and we need every single Queenslander to roll up their sleeve and go and get vaccinated so they can be safe, so their families can be safe, so our entire community can be safe.
And we're happy to take any questions, if anyone has any questions. Yes? No, that's okay.
Look, I'm advised he's in a serious but stable condition. He's not in intensive care, but he is unwell. Yes, they have. As far as, well, essentially that they're all advised to go and get tested, and there's a letter drop put around that location asking people to come forward and be tested, and certainly we haven't had any positive reports come out of that.
And given the state of condition of the driver, President Hawke hasn't been able to get any other locations that he's been.
Look, at this stage we don't have any further information from him.
Minister, can we ask, it seems like Queensland's vaccination rates have plateaued, they're not really increasing like the government hoped. Is it time to change up the strategy?
Well, we have seen a bit of an uplift, which is great today. We were hovering around the 15,000 and yesterday we did 18,660. So we are seeing a slight increase, but I think as Dr. Smith said and I've said and Joe Kelly has said, we need more people to come out and get vaccinated. There's no doubt about that. This strategy, and we've been standing up nearly every single day as a government saying, please get vaccinated. We need you to reach those 70, 80 and hopefully 90+% vaccination rates, and we were right across the state. We were targeting those areas where there was low vaccination rates, but the message is simple: get vaccinated. If you have any symptoms, get tested, and do it as soon as you possibly can.
So Dr. Jeremy Goldberg, the medical director of the Gold Coast City Hospital, said yesterday that unless something drastically changes, you can't see Queensland getting past 80%. In your mind, is that still a reasonable goal? Do you think we can still get to 80%?
Look, obviously that is what we're aiming for. We hope to do that. We're at 74.1% already when it comes to the first jab. I think that was the figure. And we're hoping that over the time we've got this great window of opportunity that we can reach that 80%. And we have to. If we want normality and we want to keep people safe, Queenslanders need to come out. I know sometimes it takes a little while for the message to get through. And as I said, we have been standing up every single day as a government, encouraging people to get vaccinated, particularly our young people and particularly our rural and remote. If Pumperel can get to 90%, anybody can get, any community can get up to that level, and we're very confident that we will get to that 80% plus, but we will not stop until we get as many Queenslanders vaccinated as possible and that we exceed that 90% rate.
2 weeks ago, a Prime Minister event asked that you think we can go well beyond 80%. Do you think that was possibly over-ambitious now that we've seen that rate slow down?
I think we need to be ambitious when it comes to COVID. COVID will be the virus of the unvaccinated. And as the Premier has said time and time again, it will look for those people that aren't vaccinated, and you don't want to be, as a gentle reminder, the Uber driver who unfortunately was unvaccinated, has caught COVID and is in a very serious condition in hospital, as you've just heard from Dr. Smith. We don't want to see Queenslanders in that position. We want everybody to be vaccinated so that when COVID enters this state, we are best placed in the position. We are world leaders. Queenslanders are world leaders at the moment in how we have handled COVID and the way Queenslanders have responded to the calls of the government and the various measures we've put in place. But as Dr. Smith said, there's only some of those measures that we can use. Vaccination at the moment is the best one. We didn't have a vaccine last year. We have one now, and we're very confident that we will get at least to that over 80%, and we're looking forward to freedom really opening up once we get to 90% plus, and I'm sure we can get there.
Does the government acknowledge, though, that it's probably going to be a slower burn, if you will, from here to get to 80%?
Yes, look, I think it may take a little while to get there, but this is why we're out and about today. Do it for your friends, do it for your families. That's why we're opening up schools, that's why we're opening up Bunnings, that's why we're trying everything we possibly can to encourage people to come out and get vaccinated. And I think I will keep saying it a million times, if you haven't been vaccinated, please do so. It is the best protection you will have for yourself, your family, your friends and your mates. Vaccinate.
If we don't hit 80% by that December 17th date, does that increase the likelihood of lockdowns around that Christmas period?
Look, if we don't get to the 80%, obviously the Premier has stipulated a number of times that the 17th of December is locked in. What it means is that the vaccine will come into Queensland. The virus will come into Queensland. There is no doubt about that, and it will seek out those that aren't vaccinated. So we want to make sure we protect as many Queenslanders as possible, from the young right through to the elderly, and we're urging everyone to get vaccinated. Well, I know there was a school in New South Wales, I think that was open for 3 days. They had a positive case and they had to close down. for a clean and a lockdown. We do not want to see that. Obviously, the 17th of December is strategically picked because it's a week after school ends at the end of this year, and we won't be having students attending school. They'll be away from the school environment. But already New South Wales had a school closed down 3 days after they had the red carpet out welcoming the students back in. We don't want to see that. We want to see as many people vaccinated so that the virus does not spread. We can protect ourselves, our families, Queenslanders, the whole lot. But of course, you can't rule anything out. We want to make sure that the higher we get those percentages, the more freedoms and the more opening of Queensland we will see.
Mr. Not sure this one is for you or the Deputy Chair, but the gentleman on the Gold Coast, the Uber driver, how's the police investigation progressing? And now is there any more information
Yes.
from him as to how we got into Queensland?
I might get Dr. Smith to refer to that one in relation to whether we're able to question the Uber driver in hospital. I do believe he is seriously ill, but I think Dr. Smith probably has more info than I do.
Well, look,
You have to go right up.
Well, look, we routinely, in many of our investigations, involve our colleagues at QPS, the Queensland Police Service. They have been involved in this because it's important that we do things like, checking border entry and things like that. But at this point, neither from the health side of things or the police side of things, we don't have any further information. I'm sorry to say. There's challenges obtaining information from him. Let's just leave it at that.
Thank you, Dr. Smith. Can I just end by saying thank you, everyone. It's a great super weekend. 116 schools open. All our other clinics are open as well. Please, if you haven't been vaccinated, come out and get the jab. Can I thank Executive Principal Richard Usher for coming out this morning and opening up our beautiful new performing arts complex here at Cavendish State High. We've got, as I said, 116 schools spread right across the state. It was an honour as Minister for Education to partner with our health workers to be able to deliver this. I know Joe's out there advocating very strongly as well, and as I said, Joe Kelly has given well over 200 jabs already for people wanting to get vaccinated. So thank you to all of the school principals and the school communities for opening up their wonderful halls and facilities, and thank you to Cavendish for having us here this morning. But remember, do it for your family, do it for your friends, do it for yourself, get your mates, vaccinate. Thank you very much.
Minister, is it time maybe to start implementing different freedoms for vaccinated versus unvaccinated people, given our vaccine rate?
I think the roadmap is envisaging some kind of possible linkages with businesses who may hold a significant event, such as a music concert, where that event, if it is opened only for vaccinated patrons, then they will not have the restrictions, and we may be able to do that. But that's up to businesses. I know some airlines are definitely going to be saying, if you're not vaccinated, you're not going to be flying too far or too wide, not only in Australia, not only, particularly international as well. So I think a lot of businesses will move to make sure that they keep their patrons, their staff and their customers and clients safe by opening their doors to only vaccinated people. I know there's a lot of beauty salons, hairdressers that have done exactly that in New South Wales and Victoria.
Is there a reason that we're making that the responsibility of businesses?
I think that the restrictions are in so that we can obviously make sure that the whole of the areas are safe. I know that businesses will be free to do that. We'll see where we go with the 70 and 80%. Nothing is always on or off the table, but businesses obviously will be determining how they want to operate, and they will have less restrictions if they do it for vaccinated patrons as opposed to those that aren't vaccinated. And we're leaving it up to them at the moment, but hopefully if we get to the 90%, we can all walk freely.
Some businesses are expressing concerns over young staff that might now have to be policing this, which, we've seen many other people throughout this whole process. What would you say to those people?
Oh, it's very easy to police. If you're walking into a nightclub, you have to show ID anyway. It's normally on your phone or whatever. I've got a little card in my wallet to show that I'm fully vaccinated, and we'll have it on my phone. I don't think it's going to be very difficult. It's a bit like the check-in app. It's a very easy process, and I think the businesses that do it will do it for all the right reasons. Safety comes first, and they want a healthy clientele and obviously a very healthy staff and workers as well. Thank you, everyone. Thank you.